Hi, I'm Dr. Aliabadi.
And I'm Mary Alice Haney. Welcome to SHEMD. I'm so excited about our show today. Our guest is the Memorial Sloan Kettering oncologist and medical historian, Dr. Elizabeth Comen.
Today, we're going to get a crash course in the problematic history that has shaped women's healthcare. We know women's issues are underfunded, under-researched, and often misdiagnosed. Today, we're going to learn the root cause of the societal stigmas and lingering ignorance that shape women's healthcare and our relationships with our own bodies.
Thank you for tuning in to SHEMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SHEMD, some of the products and services we discuss may involve sponsorships or paid advertising. On today's episode, we are so lucky and honored to have Dr. Elizabeth Comen. You are going to be so excited because you guys are sisters from another mother. I'm just going to say that right now. Dr. Comen is an award-winning, internationally sought-after clinician and physician scientist. She's also a medical historian and the author of All in Her Head. Dr. Comen works as a medical oncologist with a specialty in breast cancer at Memorial Sloan Kettering Cancer Center and is an assistant professor of medicine at Weill Cornell Medical College. She earned her BA in History of Science from Harvard and her MD from Harvard Medical School. She then completed her residency in internal medicine at Mount Sinai Hospital and her fellowship in oncology. We are so thankful that you're here today. This is going to be an episode about your book, about bias in medicine with women, about oncology, something so dear to Dr. A's heart as well.
Well, I'm so excited to be here with you, ladies. Thank you for having me.
Can we just start off by talking about, your resume is incredible. I did not go to Harvard, but I play someone that did on TV. Not really, but your resume really is incredible. Can you talk about how you went from oncology to writing this book and why you felt it was so important?
Sure. So you said my resume and how I majored in the history of science in college. And I've really had this long-standing passion in understanding that medicine and science does not exist in a vacuum, but is really inextricably linked to culture, religion, society. And in that, my journey to becoming a doctor and focusing on women with breast cancer, I've always been interested in the experience of illness, and in particular, the experience of illness for women. And we know that it does not happen in a vacuum, but who we are, how we're treated, how we're perceived, how we're cared for is very much related to what society thinks of us, what culture tells us, what religion tells us, and the stories that we're told about our bodies. So my book, All in Her Head, The Truth and Lies Early Medicine Taught Us About Women's Bodies and Why It Matters Today, is a walk through women's bodies by organ system. So we often think of women's health as really just gynecology or our breast health, but in reality, we are not small men. We are head to toe different biologically and have different needs and different presentations of diseases. So the book is a walk through women's bodies by the same specialties that you may know of today, like cardiovascular system, or cardiologist, gastroenterologist, neurologist, and to introduce us to the legacy that I believe we inherit when we show up at the doctor's office today. Why it is so hard to get the care that we need, why we are sometimes invalidated, shamed, embarrassed for our medical concerns, and why in many instances, very serious conditions about women take too long to be diagnosed or worse yet, misdiagnosed.
I was floored by some of the things that I read, and I hear this a lot from Dr. A, and I can't wait for you to sort of share some stories about this, but is women's anatomy really not taught in medical school still to this day?
So I'd love to get Dr. A's perspective, but certainly during my training, and if you look at the studies, even to today's training, when you were taught in anatomy class about the cardiovascular system or the GI system, in many of the textbooks, what was presented to us predominantly was a male figure. And the times that you would see a woman's figure would be more related to her reproductive function or her breast health. And this really relates to the historical legacy of the idea of the male being the reference 70-kilogram white male for whom many of our trials and drugs were made upon. It goes all the way back to the Greeks and early medicine when the idea was women were the imperfect, inverted version of a man. And that relates to, I believe, the care we still get today.
It's not easy to talk about cancer, yet knowing your family's history of cancer is a first step to understanding your own risk and may qualify you for genetic testing that can help inform your way forward. The MyRisk Hereditary Cancer Test with risk score from Myriad Genetics is a powerful tool to help healthcare providers identify your risk of developing 11 different types of hereditary cancer. And risk score analyzes multiple factors to estimate your risk of developing breast cancer over the next 5 years and remaining lifetime. Breast cancers can be missed on annual mammograms, especially in women with dense breast tissue. And some patients may benefit from more advanced screenings like an MRI. MyRisk with risk score can inform decisions about additional screening methods, which may find cancer at its earliest, most treatable stage, or even prevent it. Knowing your cancer risk can be just the beginning of more personalized care. Learn more about MyRisk with risk score at getmyrisk.com. That's GETMYRISK.com. Well, we hear a lot about the fact that the clinical trials are not taking place on women, that really all of these trials, and so therefore the medicine, we hear about statin really, we just heard that this week, that the trials are really done on men and there's not a lot happening with women. So that just seems crazy. We're half the population.
Yeah. So, and you're talking about statins. So heart disease is the #1 killer of women in this country. And yet it was not until 1993, as you mentioned, that the government NIH-funded clinical trials were even required to include women and minorities. And we are still playing catch up today because it's not just about the clinical trials, but also what's being done in the lab. And we often use cells or mouse models to develop drugs. And historically, these were used on male predominant cells or male mice because we're so hormonal, even though those mice are so hormonal too. So it's impossible that we could actually be studied in any way because everything's just so all over the place.
It blows me away every day. We sort of talk about this and my jaw's on the ground about, as the, one of the biggest, brightest, most amazing doctors on the planet, you're still also having this gender bias happen to you.
I mean, we've always had gender bias in medicine. To this day, even if I walk around in the hospital with a long white coat, people still address me as nurse. It's very rare that someone calls me a doctor when they don't know me. Even when I make a post on Instagram and I'm hugging my patient, the first comment is, look how nice this nurse is. So people just associate men with in medicine as being doctors and women being the nurse. And by the way, women do the same. We do it to ourselves. So this has been going on for years.
I think what you're really also speaking to is how much societal influences or societal and cultural beliefs influence both female physicians and also female patients. I'm sure we could have an entire episode of the experiences we've had as female physicians about what we could look like, what we could wear, whether I could wear my hair down and be seen as professional, how my voice needs to sound, how I need to think about how men in positions of power will see me. I mean, I have heard so many things. And there's also this idea that the feminine spirit and empathy and nurturing goes along more with the nursing profession as opposed to doctoring. Doctors are there to cure and to fix, and nurses are there to comfort and provide TLC. And of course, we know that as female physicians, we're also expected to be that mom consult, to listen longer, and we do, and to take better care. One of the things I talk about in the book is I don't believe that men are incapable of this. Of course, we both know incredible men and incredible male healers and physicians who are capable of having that nurturing spirit. But so much of our culture and society has sidelined, and the history of medicine has sidelined that spirit from our medical system. And I believe it's why so many women feel uncared for in medical settings.
I also think it does a real disservice to nurses who are also real healers and,
Yes.
Nurse practitioners are, can do a lot of the same things that doctors can do. And I think that it's just this bias on both sides that, if you see a male that's a nurse, it's like, well, you're a nurse. Why didn't you go to medical school? It's like on both sides, it feels that way. Mm-hmm. Can we also talk about, you talk a lot about shame in women's bodies and, where that came from. I was thinking about that as I was reading this morning. I remember this so distinctly. I grew up in the South, one of 5 children, 4 girls, and I didn't tell my mom or my dad that I got my period. I was ashamed of it. And I hid the tampons. I didn't want it in the, it was like this real shame around having my period. And there was one night when I got the flu, and my mom came in and saw the tampons, and she was like, "Well, why didn't you tell me?" And I was just like, "I don't know. I was ashamed." Where does that come from? I mean, it seems like when you in your book you talk about goes way back in history with that.
Yes. So, and I'm sure Dr. A has lots of stories of patients feeling pressure to like go get waxed or shave their legs or get a pedicure before they show up to have their baby, for goodness sake. And in my practice, I have countless heartbreaking stories of women apologizing to me on their deathbed for sweating or for normal bodily functions. And this is really one of the driving forces for why I wrote this book, to unpack this legacy throughout history of why and how women have been taught to shame their bodies. Men get to mansplain and spread their legs I'm in New York City on the subway, but our genitalia is private and vulgar and not worthy of pleasure unless it's in the context of male desire. There are so many levels of this shame. And of course, with menstruation as well, and our hormones, every turn towards our body has been about even looking in illness as somehow romantic, that we have to look pretty even when we're sick. And that is in large part why I wanted to write this book. Could we have a new narrative about our health moving forward?
Yesterday, a doctor that we had on the podcast said that 10% of women have never had an orgasm. And we said if that was 10% of men, it would be a national emergency. I mean, it would be blaring on every news channel. I mean, there really is. It's just this is incredible to me.
I mean, this is ongoing even in medicine with like painful periods, endometriosis, PCOS patients who gain weight because of insulin resistance, and they're constantly being dismissed, constantly. And one of the most common things I hear in my office when I diagnose these patients years into it, every single one of them tells me that for the first time in their life, they feel validated because people don't listen. They dismiss their symptoms. This is a big issue in medicine.
When you talk about when you talk about 10%, in many instances, I am actually surprised. I bet it's even higher in some communities and some settings because I hear it a lot.
Can you guys talk to, I think this is such an interesting topic too, especially coming from the two of you as an oncologist and someone that has survived breast cancer. The breasts are so feminine in this idea that, we give life from our breasts and milk and all of that. How do you, as someone that survived, how did you think about that? And this week with Olivia, you were also, there was a video where you were giving her a hug and you were saying, this means nothing. This, this is your life. And I mean, but do you feel that, or did you feel that?
For me, especially when you're a mom of 3 children, I didn't care at all about my breast tissue. Breast tissue, to me, it's an appendage on my body. I don't even need it, right? Once you're done having kids and you're done breastfeeding, for me, and when I was doing it, and to this day, I still have women who come and they're like, well, don't you feel like you're disfigured? No, I don't. For me, I wanted to survive and nothing else mattered. But again, that's a very personal decision. Personal. I see, I had a patient once who said I would give a limb to stay alive and to be around for my children. And that's exactly what I would do.
And Dr. Comen, what about you when you're dealing with women with breast cancer?
So, yes, I think it's extremely personal and individual. The history of operating on women with breast cancer was doing radical disfiguring mastectomies, not what we're capable of doing today. And you use the word appendage, which is very interesting because at one point in medical history, there were many doctors that also referred to women's breasts as useless appendages globally. You made that decision and that's your feeling about it. But these medical arbiters of what was available to women would blanket state that about all women. And we know, of course, that women may have different journeys about how they feel about their body. It was not till much later that we knew that you could, in some instances, not always, do a smaller procedure called a lumpectomy and radiation and have the same outcomes as a mastectomy. There are lots of different choices that go into whether a woman chooses to do a bilateral mastectomy, a nipple-sparing mastectomy, mastectomy, remove the lump and do radiation. It all depends on her diagnosis and her personal choices. But the history of developing breast implants and breast reconstruction was not for breast cancer patients, but was really out of a plastic surgery boon to kind of say that women with small breasts would have an insecure complex about themselves. And it was really about pathologizing women and capitalizing on that. And only later have we become more compassionate about the ways to thoughtfully reconstruct women's breasts, should they desire that, and also give women many options, right? Some women want an aesthetic flap closure, which means that you don't even put an implant or have any tissue remaining, but it's just flat with the nipple. Some women may choose implants. Some women may choose all sorts of other options. The key is that we listen to women, listen to how they feel about their bodies, what matters to them, and that we continue to develop very good options for them that allow them to thrive, but also survive.
And Thais talks about that all the time. She said, that was my choice, and I wanted to make that choice. And everybody around me said, you're crazy, you're hysterical, you're this, you're that. And she says to me all the time, it's up to every woman. What's right for me is not right for her. And that's why you're such an amazing doctor, because you look at each patient as an individual and what you can do for them.
And often, even as of yesterday, I had a nurse at my surgery center who approached me about Olivia's story and said, Dr. A lot of these male physicians are saying 37%. Why are you so hysterical about 37.5% lifetime risk of breast cancer? And in reality, I always say, unless you have breasts on your chest, you're not allowed to comment about that. Unless you're a mom of little children at risk for breast cancer because of your breast tissue, you are not allowed to call me crazy, paranoid, or anything else. So this is really challenging, especially, like you said, it's such a personal decision.
And your decision might not be the same as another woman. Another woman might be perfectly fine with going down that route, and that's okay too. Today's SHEMD podcast is sponsored by Dreamland Baby. Dreamland Baby's weighted blankets and swaddles are designed to help your baby relax, fall asleep faster, and stay asleep longer. My boys are teenagers now, and rather than waking up for their midnight feeds, I'm waiting up for them to come home at night safe and sound. When they were babies, my worries were so different. I tried everything to get them to sleep through the night, rocking them, swaddling them, pacifiers, anything to get them to sleep. And trust me, swaddling a baby with a baby blanket is not easy. I would have given anything to have the Dreamland Baby sleep sack back then. So many of my friends rave about how it's helping their babies stay asleep longer. And when they sleep, you sleep. The Dreamland Baby's weighted sleep sack is now my go-to gift for baby showers because it's made of 100% soft and natural cotton. It's fuss-free and easy to use. New moms and dads need sleep, so it's the perfect gift. And it's also 100% cotton and super soft. Baby's skin gets irritated easily, so I only wanted the softest material next to my boys. Go to dreamlandbabyco.com and enter my code SHEMD at checkout to receive 20% off site-wide plus free shipping. This offer is for new and existing customers. It's hard enough making healthy choices for food, but throw in forever chemicals that cookware and appliances are made with, and you can get overwhelmed. Most cookware brands continue to use these chemicals due to their low cost. It sometimes feels like a losing battle. You're cooking healthy, but your cookware is not. That's why I love using Our Place's non-toxic, healthy, sustainable cookware and appliances. Our Place is a mission-driven and female-founded brand that makes beautiful kitchen products that are healthy and sustainable. Leading the change, Our Place has always been PFAS-free and offers the most durable, toxin-free ceramic coating, ensuring a healthy, safe cooking experience. In addition to cookware, these toxins are also frequently used in appliances, especially air fryers, pressure cookers, crock pots, and even the rims of blenders. So you can be making your green smoothie and getting those toxins at the same time. That's why Our Place came out with non-toxic appliances. And did we mention they're beautifully designed in gorgeous colors that feel like art objects? They make me feel creative in the kitchen. Upgrade to Our Place today and say goodbye to forever chemicals in your kitchen. Go to FromOurPlace.com and enter my code SHEMD at checkout to receive 10% off site-wide. That's FromOurPlace.com, code SHEMD. Our Place offers a 100-day trial and free shipping and returns. We have a Bernese mountain dog named Whiskey, and he really is part of the family. He snuggles with us. The kids love him. He's just the light in all of our lives. And I really want to make a big effort to feed him the best quality food. That's where Sunday's dog food comes in. Sunday's is fresh dog food made from a short list of human-grade ingredients. It was co-founded by Dr. Tori Waxman, who's a practicing vet, and tests every formulation for every version of each recipe. Sunday's contains 90% meat, 10% superfoods, and 0 synthetic nutrients or artificial ingredients. Dog parents report noticeable health improvements in their pups, including softer fur, fresher breath, better poops, and more energy after switching to Sundays. Whiskey loves it, and sometimes his breath is terrible, and I notice a big difference after he eats Sundays. Unlike other fresh dog food, Sunday's does not require refrigeration or preparation because of the air drying process. Just pour and serve. When you start a Sunday's prescription, you'll automatically get 20% off and free shipping on every reorder. Cancel or pause your subscription anytime with their 100% satisfaction guarantee. It's so easy to store and serve. You just put it in your pantry and you never have to worry about it. Go to sundaysfordogs.com/SHEMD or use code SHEMD at checkout.
I just want to clarify one thing because I hear this a lot in my office, and I think it'd be really important for our audience and listeners to just stratify this a little bit. It sounds like, Dr. A, you went for a prophylactic procedure and incidentally were found to have cancer. That's different than someone who presents with a cancer and may have an option for a lumpectomy and radiation versus a mastectomy. It has been shown that in terms of survival, because you're talking about surviving, that in many instances, a lumpectomy plus radiation is equivalent to a mastectomy in terms of survival. What relates to the survival of breast cancer is not what's in your breast. It's what possibly escaped your breast before you ever knew you had breast cancer and called what's called metastatic disease. Metastatic disease is when breast cancer cells are living in another part of your body, like the lungs, the liver, or the brain, vital organs. If you had both breasts filled with breast tissue, but those cells never moved and never traveled, you would not die from breast cancer. What makes breast cancer a scary disease is the ability of the cells to travel. So there is a difference when women go to talk to their doctor about preventative surgeries versus when they have options in the setting of being diagnosed with breast cancer. Just want to clarify that because there's a lot of confusion when I see patients in the office.
Absolutely. And thank you for clarifying that for our listeners.
And again, it's your choice. That's why we started this podcast. We want to arm women with the knowledge to make their choice so they can walk into their doctor's office and say, this is what I want to do. And this is the reason why, boom, boom, boom. So can you just tell us some of the most outrageous findings in your research that you found on women's health? This is,
yes.
You guys, this is amazing.
Yeah, I mean, I was almost every page of my own research was something that I found shocking that I didn't know about women. And despite taking care of thousands of women, there's so much that I really didn't know about our bodies. And that says a lot because I'm supposedly dedicated to this field. You mentioned the orgasm gap and how women's sexual desire is often not addressed both societally and in the doctor's office. One of the things that shocked me was how much sexual desire, libido, the need to control women in some sexual context infiltrated every aspect of medicine. If you look back, for example, I was interested in our skeletal system and orthopedic injuries, and I wanted to go back and understand the history of scoliosis. The number of founding fathers of our medical system who felt that masturbation was a cause of female scoliosis, or, the breathing issues that you have, well, it may be because you're lazy and you're masturbating. I mean, the stories in this book, real stories, were truly shocking to me. Or that you could be put in an asylum simply for having more sexual desire than your husband. And by the way, when you were at that asylum in the 1920s, you could have all your teeth removed as a cure for your mental illness. There was a Dr. Henry Cotton in the 1920s in Trenton, New Jersey, who the New York Times billed as the most progressive, amazing, brilliant psychiatrist, who had this thought that one of the reasons why women was so crazy is because they must have an occult infection that was causing some sort of derangement of their minds, and that's why they were hysterical. his number one treatment for them was removing all their teeth. This included young women. And when that didn't work, he could remove their uterus, he could remove their ovaries, he could remove parts of their gallbladder, parts of their colon. He claimed an 85% cure rate for whatever this diagnosis was, when in reality, there was a 30% mortality rate. And this was not that long ago.
That is so
it's just
crazy.
one of the many stories that I never knew in our history of medicine.
And tell the listeners, I also found this fascinating, some of the key figures that were instrumental in changing this, because you do talk about that as well.
There were many stakeholders that have improved this legacy. One of the chapters in my book talks about the history of the nervous system and what we have learned and how far we've come. And there are remarkable figures that have done a lot of good, including male neurosurgeons, male surgeons, male psychiatrists. So the whole book is not about being a Debbie Downer, but to really show some of the horrific stories from the past and how they may insidiously show up still today.
So from doing this research, what are some of the changes that you want to see that still need to happen today?
Good question. I think I'm curious about what Dr. A would say, but one of the biggest reductionist problems in our medical system is that the idea that our women's health is bikini medicine, that it's our breasts and it's our reproductive organs. I would love to see more education around menopause, more education and inclusion of women in clinical trials about the concerns that they have. Think about things like irritable bowel syndrome, or that autoimmune diseases are 80% more likely in women than men. Do we consider that a women's health issue? I certainly didn't know that. I knew maybe that it was more predominant in women, but not in the same way. Or that Alzheimer's disease is 2 times more likely in women than men. Head to toe, I would love to see more investment in women's health research. And we know that the Biden administration just recently announced $12 billion towards their women's research initiative. I think that's extraordinary. And I would love to see more cross-talk, more cross-pollination from different specialties, so that we're not just tasking our amazing gynecologists to do everything. That's simply not fair, and that's not possible in a single doctor's appointment.
And that's why I've always said I think obstetrics and gynecology need to be separated. You need to have doctors just delivering babies, and then the other half of doctors just doing GYN. What happens in OBGYN is we get so busy with our pregnant patients that we don't really have time to spend on our GYN patients who walk through the door. So when you see, and that I think is the biggest problem in OBGYN. For years I've said, if you separate these, then gynecologists will have more time to sit and listen to their patients. Half of the practice of medicine is actually listening to your patients. Endometriosis you diagnose by listening. PCOS you diagnose by listening. It takes doctors 9 to 11 years in this country to diagnose endometriosis. 90% of PCOS patients, number one cause of infertility in this country, it takes 90% of these patients are undiagnosed, go undiagnosed most of their life. They don't even get diagnosed by fertility doctors. So part of that problem is doctors are so rushed, they don't have time for these patients. So we have to start listening. But in reality, let me tell you, this gender bias is not just in medicine. We have to start at elementary schools, to teach the boys how to treat girls, to teach them how that, I have 4 daughters, 3 of them are going through an all-girls school education. And and we should have an episode on that, because I think every single girl on the planet should go to through an all-girls school education past middle school, because they empower you to have a voice, to be confident, to see yourself as equals. If every girl on the planet went through an all-girls school education, I promise you our world would change. We have to do an episode on that.
I went to an all-girls school, and I agree with that.
If you do this show, can I be provocative and be the dissenter?
Yes.
So I have 2 boys. I have 2 boys and a little girl. And the other day, my son came upon, he's 11. There was a girl crying in the bathroom. She was 5 years old. She came out and she had peed in her pants. He recognized this, shielded her from, I got a call from the school that he shielded her from everybody else, made up a story that she fell and hurt her knee, waited till a teacher came by because he knew that he had to protect her and he didn't want her to be embarrassed for something that happened in the bathroom. Now, he's one boy, but I would make maybe somewhat of a future optimistic argument that maybe if we could teach the boys to be kinder, to be gentler, to value some of the empowerment ideals that Dr. A, you're talking about so beautifully, maybe that's also a goal that we could have. Although I totally support the girls' schools as well.
Yeah, I agree with you too.
My point is this bias is everywhere. It's not just in medicine, it's everywhere. I'm from Iran, from a country that before the revolution was the most incredible country in the world until the Ayatollahs took over. And right now, women have no voice. You cannot divorce your partner. You know, everything you want to do, you can't leave the country without your partner's permission. I had a patient of mine who flew from Japan to see me, and I was like, why are you here? She said, because I have an IUD, and I went in Tokyo to change my IUD, and I was told by my doctor that, she needed a letter from her dad or her brother.
Oh my God.
This is 3 months ago.
Yeah.
So this is everywhere in every country. And I think America is we're the luckiest women on the planet. Go to Middle East, go to these other countries where women are completely suppressed.
Yeah.
And
well, but to this point, in this country, why do you guys think that the mortality rate in women of color is so high when they have children?
Because their symptoms are dismissed. Their complaints are dismissed. We had a patient at my hospital who was bleeding after a C-section, and they kept calling the doctor, and the doctor was like, well, no, she's fine. She's fine. She's fine. If that patient, I promise you, was not a minority, she would have been treated completely different. So this happens all the time. It has changed. What do you think?
Well, I think part of the threads of my book in looking at the misogyny in the history of medicine is also to show that racism and misogyny went hand in hand throughout medical history. And every aspect of women's healthcare, when you look at the bias and the lack of resources and outcomes, is compounded when you're a minority, or particularly a Black woman. If you are diagnosed in the United States as a Black woman with breast cancer, you're 40% more likely to die than if you were another ethnicity or race. Now, in some instances, Black women can have a higher incidence of triple-negative breast cancer, which is associated with worse outcomes. But overall, when you really break down the data, the reason for the increase in mortality is not the biology, but rather lack of access, inherent bias, experiences in our medical system, socioeconomic factors. And when we don't address these, we really leave far too many women behind.
And the reason we started this podcast was exactly that, because if you, in order to be your own advocate, especially in this healthcare system, you need to be educated. And until you're educated about that specific topic, you won't be able to be your own advocate when you go to the doctor's office. And that's exactly what we're trying to do. We're trying to empower them to know exactly what to do if, for example, even with breast cancer screening, if you have painful periods, what do you do? If you can't lose weight and you have acne, what do you do? Why do you have irregular periods? And by, educating them, hopefully we can empower them to be their own advocate.
I worry so much about what my kids are eating and if they're getting all the vitamins and nutrients they need. Sometimes it feels like my boys are living on In-N-Out burgers and pizza. Typical children's vitamins are basically candy in disguise, filled with 2 teaspoons of sugar, unhealthy chemicals, and other gummy junk growing kids should never eat. That's why Haya was created, the pediatrician-approved super-powered chewable vitamin. Haya is made with 0 sugar and 0 gummy junk. It's non-GMO, vegan, dairy-free, allergy-free, gelatin-free, nut-free, and everything else you can imagine. Haya fills in the most common gaps in modern children's diets to provide the full-body nutrients our kids need. Formulated with the help of nutritional experts, Haya is pressed with a blend of 12 organic fruits and vegetables, then supercharged with 15 essential vitamins and minerals, including vitamin D, B12, C, zinc, folate, and many others to help support immunity, energy, brain function, mood, concentration, teeth, bones, and more. Haya is designed for kids 2 and up and sent straight to your door so parents have one thing less to worry about. We've worked out a special deal with Haya for their best-selling children's vitamin. Receive 50% off your first order. To claim this deal, you must go to hayahealth.com/SHEMD. This deal is not available on their regular website. Go to HIYAHEALTH.com/SHEMD and get your kids the full body nourishment they need to grow into healthy adults. Bon Charge is a holistic wellness brand with a huge range of evidence-based products to optimize your life in every way. Founded on science and inspired by nature, all Bon Charge's products adopt ancestral ways of living in our modern-day world. Their extensive range of premium wellness products help you sleep better, perform better, have more energy, recover faster, balance hormones, and reduce inflammation. The list is endless. I've been noticing some wrinkles recently, more than usual, and have had real issues with sleeping and feeling tired. I try everything when this happens, and I really think that Bon Charge's red light therapy has been working. I actually heard about Bon Charge from my friend Molly Sims, and she really loves the red light therapy too. I always listen to everything that Molly says. So I started using the product and I noticed a difference. I try to use it 15 to 20 minutes a day. I'm not always perfect, but I find when I do it regularly, it really helps. What I really like is that you can switch between NIR and red light in one device. It has the lowest EMF on the market, no flicker, and it's sleek and pretty easy to store. Bon Charge ships worldwide in rapid time. It has easy returns and exchanges, a 12-month warranty on all red light therapy devices. The red light therapy devices come in small, portable, and full body panel options. Bon Charge has some other amazing products such as low blue light bulbs, blue light glasses that my kids use in front of the screen, EMF protection products, infrared sauna blankets, and 100% blackout sleep mask. I use those every time I travel. Go to boncharge.com and use coupon code SHEMD to save 15%. That's BONCHARGE.com and use coupon code SHEMD to save 15%. In your book, you talk about the hammer of the witches. Can you please talk about this? This again made my jaw drop to the floor.
Yeah, so this was a treatise that came out in the 15th century, and it's bonkers. I mean, basically, I would have been, we all, newsflash, would have been born at the stake if we were around in the 1450s, 1490s, where the idea was that, you know, so many of these women were witches and these healers were practicing witchcraft. And you know how you could identify these witches? Well, if they had what they called the devil's teat, you know what that was? The clitoris, okay? The clitoris was referred to as the devil's teat, like the nipple of the devil.
Devil's teat. Oh my God.
Yeah.
Wow.
Yeah, so we got problems, ladies. And, you know, we're healers, so we would have been burned at the stake. But it was really to go back in time and to really talk about how aspects of religion, aspects of faith pushed women and sidelined them at many different points in the history of medicine from being healers, right? Why are we so afraid of witches as opposed to the people that were burning the witches? Let's talk about the people that were burning the witches, okay? I think that's far more concerning in the history of medicine. And it relates also when you think about more subtly the rise of the field of gynecology in this country. For ancestral times, we had midwives, we had women caring for other women. But with the rise of medical science in the 19th century, men became to occupy the field of gynecology and obstetrics and pushed out midwives and did not allow them to go to medical school, did not allow them to learn about new techniques in cesarean sections or new techniques about germ theory and antiseptics. So with all of these women pushed out of medicine, the field of gynecology became dominated by men who had a lot of theories about women being crazy or what they should do. And it's no surprise then in much of our history of medicine, the idea is that women were vessels for children, and that was our value. And certainly we're not a value after our reproductive years. And so we wonder why there was no menopausal education. It was certainly not baked into the system from the very start.
Can you talk to us about Dr. Storer?
Yes, ma'am, you did your work. Storer is one of my favorite inspiring characters, but terrifying. And he was one of the reasons why I had the courage to write this book. So there was a man, Horatio Storer. Horatio Storer was a graduate of Harvard Medical School and also one of the founding members of the Boston Gynecologic Society. In doing my research about women, I came across a famous case where a woman by the name of Mrs. B, because he referred to her only by the first letter of her last name, is brought in by her husband to see him and published in a famous medical journal. And why is she brought there? Well, she has more sexual desire than her husband. And the husband says, well, she's got problems. She's having these crazy dreams and wants to have sex all the time. Of course, it's written in this medical language. And it turns out when you read the report, well, She's basically saying this older husband has erectile dysfunction. He claims, no, there's some obstruction when I try to have sex with her. Horatio Storr examines her, talks about this horrific exam that, she shrieked when she touched him, and he's clearly doing painful things to her. And he comes up with a diagnosis and a treatment plan. Well, what's his treatment plan? The problem is with her, of course. She needs to replace her pillow with needles, stop reading romantic novels, stop eating excitable foods, put chemicals on her clitoris. And if that does not work, he wants to send the husband, and Dr. Storr agree that she will be sent to an asylum. An asylum for what? Wanting to have sex with her husband? Who is this Horatio Storr guy? So I go and I look and I see that his first wife, he sent to an asylum in Worcester, Massachusetts, where she died at age 39 of what we call catamenial mania. That just refers to PMS. So why did he send his wife there? And what did this poor woman die from? It doesn't sound like she was truly sick of any mortal condition at all. Then I went and dug more into some journals about Horatio Storr, and I found that he had this penchant for putting fire pokers up cadaver vaginas in the basement of Harvard Medical School. This is not normal behavior. You know what else he did? He went on to found the Physicians' Crusade against abortion in the United States.
Yeah. When was this? What year was this?
This was at the turn of the 19th century.
Oh my God. That's not that long ago. That's insane.
That's how it all started.
And do you know the article? The title of the article about Mrs. B? What did he diagnose her with? Nymphomania.
Most husbands would be like, thank you for wanting to have sex with me all the time. Oh my God, that is terrible. This man had erectile dysfunction and he blamed it on those two women. That is the worst thing I've ever heard.
But listen, to this day, when I have couples who come to my office and, they can't get pregnant, it's always my patient's fault. Something's wrong. That's what the husbands say. Well, can you figure out what's wrong with her?
Do you ask, have you gotten your sperm checked?
Of course I educate them, of course. But my point is this is still happening. This is not so uncommon.
So there is some good news. This isn't it yet, but today, more women than men are enrolled in medical school, but women are still paid less and take fewer leadership roles. But you think there's some good news coming. And again, I think the more women that are in medical school probably will make the changes. So what do you see happening?
I think there's so much good happening. Look, I'm in New York, you're in LA, we came together. Yeah. There's a groundswell, there's a tremendous momentum across the board, from the lay public to women's groups to advocacy groups to politics, and then of course to the medical world, that women need to be heard, they need to be validated, they need to not be dismissed. We need to have equal participation in clinical trials. We need to be studied. We should not be underfunded. And when you look at the government, there's a lot more money that's going to be funded into women's research.
Thank you, Dr. Biden.
Yes, there's lots of reason to have hope. And as Dr. A said, it's, we have women like Dr. A in medicine, so that it's not just about increasing the numbers of women in medicine, but actually increasing the numbers of women who are in positions of power to make decisions about research, to make decisions about how we care for patients, how we value patient care, for goodness sake. And so I think that's what's really going to be changing, is the inclusion of feminine spirit, the being able to be our authentic selves, so that when we show up as doctors, we can do the best for our patients as women.
That is...
You're amazing.
You're amazing. Thank you so much. You made me a little teary, honestly, just thinking about that, because so many women are dismissed and told that they're hysterical and crazy, even in this modern time. So we're very grateful for women and doctors like you. And thank you so much for taking so much time with us today.
So, this has been so great. I can't wait to come back.
We can't wait to have you.
Take care.
Thank you so much for having me.
Thanks so much for joining us today on SHEMD. If you want to own your own health, follow us on social media at SHEMD Podcast and subscribe to our show on YouTube or wherever you get your podcasts.
For Dr. Comen's takeaways, visit shemdpodcast.com.